Welcome back. Well, any medical diagnosis can be a bit scary, and that rings true for a brain tumor diagnosis. But according to our next guests, they say it is treatable. So I caught up with two doctors locally here at the University of Florida Health Proton Therapy Institute to hear how they say these complicated procedures are being done locally and are attracting people from all over the globe. Take a look.
How prevalent are base of the skull tumors?
Yeah. So base of the skull tumors are relatively rare tumors. And they encompass both the brain and neck, and that's because the skull base is the junction of the head and neck. And they're very rare, but if a patient has it, then that's important for them because it's not rare to them. And it's important, therefore, to seek out academic institutions that have set up skull-based centers and therefore have more experience with that.
And I'm not sure if people realize that one of those academic centers is right here in our area. Otherwise, you'd be traveling to Miami or going all the way up to Atlanta. So that's a really unique component to our community.
Absolutely, and we're very fortunate. University of Florida invested a lot of time and finances to recruit highly specialized physicians, both not only in surgical component, but in radiation and oncology. And there is a multiple specialty of doctors coming together to create the skull-based center. And we're very proud of it. I think we provide excellent care. And we have an approach to patients that involve multiple doctors and not just one doctor deciding.
And let's talk a little bit about that approach and the treatment and what makes it so unique here.
So these tumors, are challenging tumors to manage, arising from the skull base. There's a lot of critical structures in the surrounding area, so a lot of potential to cause injury both from surgical perspective and from radiation oncology. And so it's important to manage these in a multidisciplinary fashion, as Dr. Tavanaiepour was saying, in terms of pulling in together all of the different disciplines that would be involved. And these tumors are typically managed with a component of surgery, and or radiation therapy, sometimes also chemotherapy, depending on the exact subtype of tumor. After surgical care, oftentimes these tumors will require post-operative radiation therapy, and we're a very unique center in that we've married as well to the center, the Proton Therapy Institute, which offers a very specialized form of radiation
And
therapy.
talk about that, proton therapy. What makes that so unique?
Proton therapy is a type of radiation treatment that is very effective and very focused in the way we deliver the radiation. And so because it's much more precise than conventional radiation, we're oftentimes able to deliver a higher dose of radiation in some cases to tumors than would otherwise be possible with conventional radiation. And that oftentimes may lead to an improvement in the chance of controlling the tumor. At the same time, because it's much more focused and precise, we can spare a lot of the critical surrounding structures, structures that are important for vision, hearing, swallowing, scent, so important critical functions, and therefore at the same time also decrease the risk of treatment effects.
If someone's watching now, how do you even know that you could potentially be having a base of the skull tumor? Are there warning signs and symptoms, or are these things that you just need to be going to your physician regularly and checking out? I mean, how do you get to that point where you even know that you might need this specialized treatment?
So it depends. The skull-based tumors in general encompass a variety of tumors, and so it really depends oftentimes on the location at which they arise. But they may present at times with changes in vision, so double vision or vision loss, hearing loss. Sometimes there may be hormonal deficits, or there are also some tumors that may arise in the sinus or nasal passages, which then extend or invade into the skull base, and so you may have nasal symptoms as well, or headache, or nausea and vomiting. And so the key thing is if you develop any of these type of symptoms and they persist or worsen over time, that certainly you seek medical attention, which will ultimately lead to further investigations.
Right. And knowing that there's a specialized facility that has specialized training that I know that you both have had, and we have about a minute left. Talk about the specialized training. I know it's hard to do in a minute, that you both have had that have led you to be able to head up an establishment such as this.
Well, our team at the UF Skull Base Center, every member of that has subspecialty training, meaning not only are they a general radiation doctor or surgeon or radiologist, but they've gone additional training or a year or two of fellowship in the brain, spine, and skull base. And that provides expertise that are just very difficult to come by.
Gentlemen, thank you so much for your time. Appreciate your expertise.
Thank you.
Thank you.